Within this video, we are going to provide you with details about the Rapid Diagnosis Clinic and share some information that you may find helpful ahead of your appointment with us. The Rapid Diagnosis Clinic provides a detailed and personalised assessment and rapid access to diagnostic tests for people who have vague symptoms that could be caused by a cancer. The aim of this clinic is to reach a diagnosis quickly so you have a plan of what will happen next, or you can be reassured that your test results are normal. Throughout this video, our clinicians are going to talk you through each stage of the process, from referral to your appointment to what to do after you've been seen by us.
I'm going to explain a little bit more about your referral to the Rapid Diagnosis Clinic. Your GP has referred you to the clinic for further investigation of your vague symptoms. The symptoms you have may be caused by a number of conditions, but they could be due to cancer. It is important for you to be seen quickly in order to fully investigate your symptoms. There is strong evidence that early diagnosis gives the best chance of successful treatment in many serious illnesses, including cancer. You should be aware that most people coming to the clinic will not have cancer. They may have a different diagnosis and they will be referred to a specialist for further management, or they may be reassured that there is no serious cause for their symptoms and be referred back to their GP.
Before your appointment, your GP will organise some blood tests. It is important that these tests are done before your clinic appointment. If your referral is appropriate, the Rapid Diagnosis Clinic team will contact you by telephone to arrange an appointment, which will be at short notice. The team will talk you through what will happen in the clinic, and you'll have the opportunity to ask any questions or seek clarity on what is being discussed. You will be asked to attend an appointment for a CT scan. Your appointment letter will explain everything you will need to do to prepare for your scan. All instructions regarding medication will be given over the telephone. You will be invited to an appointment to be seen in the Rapid Diagnosis Clinic after your scan. We encourage you to bring a friend or family member with you for support.
When you are invited to the Rapid Diagnosis Clinic, you will be greeted by a member of the clinical team and invited to take a seat in the waiting area. Clinics will be held on Monday or Thursday mornings in Suite 17 at the outpatient department in the University Hospital of Wales. We encourage you to ask the clinic staff any questions you may have. When you see the clinical team for the first time, they will take a medical history and examine you. We advise you to wear loose and comfortable clothing that can be removed easily. After you leave the clinic, the key professionals involved in your care will meet together to review your test results and discuss what happens next. The clinical nurse specialist will then arrange to telephone you later in the day to go through your management plan, which may include a referral to another department or back to your GP for further tests.
Shortly after your clinic appointment, your GP will receive a letter explaining your test results and diagnosis. If you have any questions after the clinic, you can contact the Rapid Diagnosis clinical team using the details given at the end of this video or found on the web page. If you do have any questions, or if you do not hear from us within 7 days of being referred by your GP, you are welcome to contact us on the numbers shown on the screen.